Uh, I'm a physician. So today I'm going to discuss or tell you in brief about healthy diet for a healthy heart or for good health in general. So we all know that heart diseases are the most common cause of death globally. In the language of a common man, heart attack is the reason behind the deaths globally, which is the most common reason. So today I'm going to discuss in brief how our good health, good diet, or good lifestyle choices in general, how that can positively or negatively impact our health or our heart health. So it becomes very important for us to do whatever we can to give us a best possible chance to live a long, healthy lives. So regarding diet or nutrition or healthy diet, I will try to divide this into two halves. What we should avoid doing, what we should reduce in our diet, and secondly, what we should consume more generously or increase in amount to give ourselves the best chance of having good health. So firstly, I would like to tell what we should reduce in our diet or in our lifestyle or in our routine in general, which obviously if continued negatively affects our health. So first of all, I would like to say that what I should say a big no or absolute no is to smoking. Smoking has been found to have negatively impacting our health, our heart health, continuously over the decades, in fact centuries. So a big no to smoking. We should limit intake of processed foods, junk foods, and refined carbs. They have been found to have, again, negative association with our heart health. They increases the risk of dyslipidemia and atherosclerosis in general. So we as Indians are very fond of eating maybe fast food, street foods. So I'll not say ki totally cut them, don't take them at all, but as less you'll take, better it would be for you. So these pastries, these cakes, samosa, pakoda, pizzas, try to limit their intake as less as possible. Thirdly, in our diet, we are very fond of, as Indians, we are very fond of eating sweets. So they come under simple carbs, again, not good for our health in general. So try to limit the intake. Maybe you can limit them to festivities only. Limit the intake of obviously these sweets. Thirdly, very important is to reduce intake of salt or sodium. Our body generally in 24 hours, we need to take maybe less than or equal to 1.5 gram of salt. But more we consume extra salt upon our maybe the salad we are consuming, maybe the extra curd we are taking, or we try to sprinkle salt upon our salad or these fruits. So try to avoid that and try to limit intake of your salt on a daily basis to less than maybe 1 teaspoon per day. Another thing I would like to tell is that you should avoid maybe heating your these oils to smoke point. Lipid Association of India recommends that you should avoid heating oil to the smoke point. And you see, this is the practice we commonly do in our households. It changes the character of oil to trans oils, trans fats. So again, which has a negative impact upon our health. Secondly, now I would like to come to what you should do more often, what you should what you should consume more generously to have good impact upon our health. First, obviously, first and foremost is your fruits and vegetables. Lipid Association of India recommends that you consume maybe 4 to 5 servings of fruits or vegetables per day to have good positive outcome for your heart. Another practical tip I would like to give is to include maybe a plate model. Plate model means when you start eating, you should fill 1/2 of your plate with fruits and vegetable oil. And then 1/4 of the plate should have lean proteins, a good source of proteins. If you consume non-veg, you can add maybe chicken, maybe eggs. If you eat vegetarian diet only, then you can add more of sprouts, more of paneer, more of soybean, etc. On the other quarter of the plate, you can add healthy carbs and fats. So that was about the plate model. Another thing you should add in your diet is this complex carbohydrates. So we can replace your white rice with brown rice. You can replace your white bread with brown bread. Thirdly, you should choose more of healthy oils. Obviously, we use oils for cooking. So LAI, Lipid Association of India, recommends that mustard oil and canola oil. Thirdly, extra virgin olive oil. They are considered most heart healthy oils. So you should pick them for cooking rather than other oils. They consume fairly good amount of omega-3 fatty acids, which are considered to be protective for your heart. Thirdly, you can increase consumption of maybe nuts and seeds. Again, considered to be protective and good for your health. In fact, almonds and your walnuts, akroot or badam, they are considered to be they are found to have good cardioprotective benefits. Fourthly, you can pick maybe low fat dairy, which are having less of fats. So low fat dairy. Fourthly, I will recommend maybe going for intermittent fasting. Recent evidences suggest that taking your dinner early and taking your breakfast a little late in the morning increases that fasting period. So consider to be healthy for your health in general. Last but not the least, in your diet part, I would like to say that the recent evidences also suggest that green tea has been found to have good heart-related benefits also due to its antioxidant properties. So that was about the diet and nutrition part, what you should avoid and what you should take more often to give yourself the best chance for having a good health. Lastly, I would like to add that on top of it, the cherry on the top of this cake is that you can incorporate some amount of physical activity, exercises that will again enhance your heart health and your health in general. So ADA recommends that you do 150 minutes per week of moderate intensity activity or vigorous activity of 75 minutes per week, which is spread obviously over 5 to 7 days. So that was about the lifestyle choices that we can make for giving ourselves best chance of living long and healthy. Thank you. Wish you all good and healthy lives. Thank you.